Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Parenteral nutrition. A nurse is caring for a group of clients on a medical surgical nursing unit. The nurse recognizes that which of the following clients would be the least likely candidate for parenteral nutrition. Option A. A 55-year-old with persistent nausea and vomiting from chemotherapy. Option B. A 44-year-old client with ulcerative colitis. Option C. A 59-year-old client who had an appendectomy. Option D. A 25-year-old client with a Hirschsprung's disease. Right answer is Option C. A 59-year-old client who had an appendectomy. The client with an appendectomy is not a candidate because this client would resume a regular diet within a few days following the surgery. Options are incorrect because parenteral nutrition is indicated in these clients since their gastrointestinal tracts are not functional or who cannot take in a diet enterally for extended periods. A client is receiving parenteral nutrition, PN, suddenly is having a fever. A nurse notifies the physician and the physician initially prescribes that the solution and tubing be changed. The nurse should do which of the following with the discontinued materials? Option A. Send them to the laboratory for culture. Option B. Save them for a return to the manufacturer. Option C. Return them to the hospital pharmacy. Option D. Discard them in the unit trash. Right answer is Option A. Send them to the laboratory for culture. When the client who is receiving PN has a high temperature, a catheter-related infection should be suspected. The solution and tubing should be changed, and the discontinued materials should be cultured for an infectious organism. A nurse is changing the central line dressing of a client receiving parenteral nutrition, PN, and notes that the catheter insertion site appears reddened. The nurse next assesses which of the following items? Option A. Time of last dressing change. Option B. Tightness of the tuning connections. Option C. Client's temperature. Option D. Expiration date on the bag. Right answer is Option C. Client's temperature. Redness at the catheter insertion site is a possible sign of infection. The nurse would next assess for other signs of infection. Of the options given, the temperature is the next item to assess. A client receiving parenteral nutrition, PN, complains of a headache. A nurse notes that the client has an increased blood pressure, bounding pulse, jugular distension, and crackles bilaterally. The nurse determines that the client is experiencing which complication of PN therapy. Option A. Air embolism. Option B. Hypovolemia. Option C. Hyperglycemia. Option D. Sepsis. Right answer is Option B. Hypovolemia. Hypovolemia is a critical situation and occurs from excessive fluid administration or administration of fluid too rapidly. Clients with cardiac, renal, or hepatic dysfunction are also at risk. The client's symptoms presented in the question are consistent with hypovolemia. The increased intravascular volume increases the blood pressure whereas the pulse rate increases as the heart tries to pump the extra fluid volume. The increased volume also causes neck vein distension and shifting of fluid into the alveoli, resulting in lung crackles. A nurse is preparing to change the parenteral nutrition, PN, solution bag and tubing. The client's central venous line is located in the right subclavian vein. The nurse asks the client to take which essential action during the tube change. Option A. Turn the head to the right. Option B. Inhale deeply, hold it, and bear down. Option C. Breathe normally. Option D. Exhale slowly and evenly. Right answer is Option B. Inhale deeply, hold it, and bear down. The client should be asked to perform the Valsalva maneuver during tubing changes. This helps avoid air embolism during tube changes. The nurse asks the client to take a deep breath, hold it, and bear down. Options is incorrect because if the intravenous line is on the right, the client turns his or head to the left. This position increases intrathoracic pressure, can cause the potential for an air embolism during the tube change. A nurse observes the client receiving fat emulsions is having hives. A nurse reviews the client's history and note in which of the following may cause about by the complaint of the client. Option A. Allergy to an egg. Option B. Allergy to peanut. Option C. Allergy to shellfish. Option D. Allergy to corn. Right answer is Option A. Allergy to an egg. Fat emulsions, lipids, contain egg yolk phospholipids and should not be given to clients with egg allergies. A client receiving parenteral nutrition, PN, complains of shortness of breath and shoulder pain. A nurse notes that the client has an increased pulse rate. The nurse determines that the client is experiencing which complication of PN therapy. Option A. Air embolism. Option B. Hypovolemia. Option C. Hyperglycemia. Option D. Pneumothorax. Right answer is Option D. Pneumothorax. Pneumothorax might happen during a parenteral therapy due to inexact catheter placement. In order to prevent this, the nurse obtains a chest X-ray after insertion of the catheter to ensure proper catheter placement. A nurse is caring for a combative client who is ordered to have a nutritional therapy using parenteral nutrition, PN. The nurse should plan which of the following measures to prevent the client from injury. Option A. Monitor blood glucose twice a day. Option B. Instruct the relative to stay with the nurse. Option C. Measure 24-hour intake and output. Option D. Secure all connections in the parenteral system. Right answer is Option D. Secure all connections in the parenteral system. The nurse should plan to secure all connections in the tubing. This will prevent the client from pulling the connections apart. Nurse Spencer is caring for an anorexic client who is having total parenteral nutrition solution for the first time. Which of the following assessments requires the most immediate attention? Option A. Dry sticky mouth. Option B. Temperature of 100 degrees Fahrenheit. Option C. Blood glucose of 210 mg/dl. Option D. Fasting blood sugar of 98 mg/dl. Right answer is Option C. Blood glucose of 210 mg/dl. Total parenteral nutrition formula contains dextrose range from 5% to 70%. A blood glucose level of 210 mg/dl is considered high. Nurse Russell is preparing to give a total parenteral nutrition using a central line. Place the following steps for administration in the correct order. 1. Connect the tubing to the central line. 2. Regulate the electric infusion pump at the ordered rate. 3. Maintain aseptic technique when handling the injection cap. 4. Check the solution for cloudiness, particles, or a change in color. 5. Prime the fourth tubing through an infusion pump. 6. Select and flush the correct tubing and filter. Option A. 4, 3, 5, 6, 1, and 2. Option B. 6, 4, 5, 1, 3, and 2. Option C. 4, 6, 5, 3, 1, and 2. Option D. 3, 4, 6, 1, 5, and 2. Right answer is Option C. 4, 6, 5, 3, 1, and 2. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.